This past long weekend was a horrific weekend for violence here in the city. 14 shootings, 17 people were injured. Now, incredibly, no one was killed. This morning on Breakfast Television, we had a chance to talk to Dr. Najma Ahmed. She is the head of the trauma unit here at St. Mike's about the impact of those shootings. While people may have survived, it is a lifetime of recovering, not only for them, but the emergency personnel who are helping them. A weekend like that, your thoughts on it?
Yeah, it's kind of nutty and crazy and horrific and unprecedented, I think, for Canadians and for Torontonians. I think it gives us an opportunity to pause and think, do we really want to live like this, and what can be done about it?
Doctors have become incredibly good at saving people's lives with some of these injuries that just a few years ago would have killed them. But this is not they get up and walk away the next day. They're all good.
Very true.
These are horrific injuries.
These are horrific injuries. These are weapons of war that are intended to kill and maim people. And so when they come to us, they're really at the very end of their life. And we pull them back from the jaws of death. They often require hours of surgery, multiple operations, weeks in the ICU, months in the hospital, and years of rehabilitation.
And let's talk a little bit about the doctors, the nurses, all the incredible teams that are around that. This must just leave them drained and in danger of PTSD and other horrible situations.
Yeah, it's very emotionally taxing. It's very emotionally taxing to see these are often young people so close to death, and all the things that we have to do to get them back. It's very hard for healthcare professionals. It's called vicarious trauma, and we too suffer. There's often debriefs after these terrible weekends and awful shootings, and people just talk about how physically drained, emotionally numb they feel. Are
the medical staff getting that beyond, like, are they taking advantage of that, and do you feel it's working, or is more needed?
Yeah, I think more is needed. It's a busy environment, and so your mind's always on the next patient that's coming through the door and the next task you have to complete. But we've gotten better at debriefing after terrible things like this and talking about the things that could have gone better, things we have done to prepare our staff more, and what it means to be in that room when someone's dying or potentially dying. You're watching a young person who was just well and alive 10 minutes ago, and now they're going to expire unless we intervene, or they may well expire.
And it's such a balance for the staff because you want to be clinical, but you can't forget the human being that's there.
100%. These are people. This is someone's son, someone's daughter, someone's brother, someone's father, and their families are never the same, even despite our best efforts and all that we can do to save them. Dr.
Ahmed's group, that she is a member of Doctors for Protection from Guns, is pushing for tougher gun laws across the country.